At Karolinska Institutet, we see industry collaborations as essential for turning research into real-world impact. It gives us access to tools and perspectives that we don't have on our own.
When you work with advanced therapies, it's usually very time-consuming and, of course, costly.
Normally, we know it takes at least 15 years to move the scientific findings to clinical care. It's a very long time.
And to have the industry as a collaborator is really critical for achieving the goals that we aim for.
I think this is especially important today when science is moving on so quickly.
And I believe strongly that this helps us move faster so that breakthroughs in the lab can reach patients and healthcare systems where they really matter.
No one can do it alone, but we really need to work together.
Our mission is to improve human health through research and education.
One of the great benefits is to see the patients that you have treated. We have seen it in a condition called age-related macular degeneration, where millions of people are now treated. We have seen patients suffering from a fairly common cause of blindness in younger people, and we have seen how the treatment has actually changed their lives entirely.
Industry partnerships help us turn knowledge into action. They bridge the gap between discovery and real-world solutions. And this is something that we cannot do alone in academia.
I have been working with the Alzheimer project for many years. And during these years, we have learned that Alzheimer's disease is very complex. We know that the disease starts maybe 20 years before we can make the diagnosis. And now, finally, we have found new tools and biomarkers so that we can identify the at-risk persons much earlier. And we can really have the precision prevention so that the right patients are getting the right treatment at the right time.
So when we team up, research doesn't stay in the lab. It reaches patients faster.
The treatments are more and more complex, but the time from the bench to the bedside is actually decreasing all the time. None of this would have been possible, of course, without the input and collaboration with the pharma industry.
And we are also now with joint forces designing the next generation of clinical trials where we can use the experiences of these projects. We all work together to find new solutions and applications for the patients, the families, and the whole society.